Hello, everyone. It's good to be back, and I hope you are well and are ready to learn a bit more and, of course, also ask your questions tonight. And I am your host, Caroline, as always, and I'm very, very pleased to have you here. This is Dr. Jessica Garcia. And how are you feeling tonight, Jessica?
I'm fine, thank you. It's a pleasure to be here.
Thank you so much for joining us. This is your second webinar, if I'm not wrong, with us. So, very, very
Yes,
happy and excited to have you back with us. It's been a while because I think you've been with us like even 2 years ago. So, very, very happy to.
something like that. Yes.
Exactly, that's what I remember. So, thank you so much for joining us once
Thank you for
again.
inviting me.
And well, you have definitely an interesting topic tonight, and I'm very happy that we have it here because this is a topic that seems maybe kind of simple, but I think that it's still not quietly that understood. So thank you so much as well for your presentation, because of course, as always, we will start with Dr. Jessica's presentation on understanding the menstrual cycle, and of course afterwards, as always, it will be time for your questions, and you need to simply put the questions in the chat section, and Dr. Garcia will take care of them for you right after her presentation. And as always, as you know, there are over 300 webinars we've done so far. So my IVF answers, I would say, is going strong, and we are keep on working, and we are focusing on bringing new topics to you. And we are definitely happy and excited to be able to do it every single day. As you know, today we were here, sorry, yesterday, and of course we have more events coming up for you. And as you know, my IVF Ancestors is a part of European Fertility Society. And before we start with the presentation, also want to say that Dr. Jessica is the fertility specialist at Clinica Tambre, and she is in Madrid right now. So I'm very, very happy to have one more team member from Clinica Tambre. Thank you so much, and it's always great to have you on board with us, of course. And that
Thank
will be
you.
it from me. I guess we can go ahead with the presentation, right?
Yes.
Excellent. Let's go
Okay.
and let's start with it then.
Okay. Well, hi. Good night. So today we're going to talk about the menstrual cycle. I think this is especially important to understand when we are doing a fertility treatment, when we're trying to conceive, to achieve a pregnancy, or just because it's really important for all of us to understand it, just to know what happens every month in our body. So, first of all, well, we're going to see the overview. We are going to talk about the definition, the importance of knowing about it. We will talk about the female anatomy just a little bit, the basic. We will talk then about the ovarian cycle and the endometrial cycle. We will see day by day what happens. And then we will do a quick overview of the whole menstrual cycle. So, the menstrual cycle is the monthly hormonal cycle that we have every month. And the main function of it is to prepare us for pregnancy. So, every month is the body changing and preparing for a pregnancy. So the menstrual cycle starts with the menstruation. It starts, and we can count since the first day that we have the menstruation. Sometimes we can have a small like spotting or small bleeding before the actual menstrual cycle starts. But we can count it as the first day when we have more like red blood and everything, not the brown one that we have sometimes before the menstrual cycle. So the typical menstrual cycle, it's about 28 days long, but it's normal also between 21 and 35 days. So also it's normal that every month is slightly different. In one month we can have it 28 days, then 29, then maybe 30, then again 28, and that also is normal. And we still count it as a regular menstrual cycle. So during the menstrual cycle, the most important thing that happens is that one egg will be developed and will be released from the ovaries. So the lining of the uterus also will prepare for a pregnancy in case it happens. That's the biggest function of the menstrual cycle. So it is super important to know about it when we are, like I told you, looking for a pregnancy, trying to conceive, or especially when we're doing a fertility treatment. This is important to understand why we are doing the scans, doing the menstruation, why do I have to inject some medication, why do we have to do the embryo transfer on a specific date, or why do I have to use estrogen or progesterone during the cycle? This is why. We're gonna know the answers here. So let's talk about the female reproductive organs. So here we have, well, the most important is the ovaries. We have two, as you may know. And so the ovaries are super important because these are the storage of the eggs. This is where we have all the eggs stored. And then this is where the ovulation happens as well. Then we have the fallopian tubes that are these very tiny structures. And the main function is to connect the ovaries and the uterus. Also, the fecundation of the eggs happens just in here, inside of the fallopian tube. So that's why it's super important to know about it. And then we have the uterus. Here inside of the uterus, we have the endometrium. This is like a very cushy tissue that we have inside of the uterus. And this is where the implanted embryo will be. Then we have the cervix, and this is the vagina. Also, something really important that is not a female reproductive organ, but is super important for the menstrual cycle to happen in the correct way. So we have the brain, and we have this structure, which is called the hypothalamus. And then we have the pituitary gland, or the hypophysis, which are super important during the menstrual cycle because they will be producing hormones that will control the function of the ovaries, and then the ovaries will produce more hormones, and then will control the endometrium as well. So everything is connected. So the menstrual cycle, it has two cycles that are separated, which is the ovarian and the menstrual cycle. There are two things different, but they are super connected, and they are happening at the same time. So during the menstrual cycle, we have the communication between the brain and the ovaries, like I told you, with hormones. So we're going to discuss everything as with a cycle of 28 days. Because this is like the average, okay? But this can be slightly different depending on the length of the cycle. So during a 28-day cycle, the main event is here, right in the middle, is the ovulation. So the main hormone that we have before the ovulation is the estrogen. That will be preparing the egg to be released, and also will be building the lining of the uterus. And then we have the progesterone. In the next part, after ovulation, we will have mostly progesterone. This will prepare the endometrium for implantation, and if the pregnancy doesn't happen, this will prepare all the tissue to shed and have the next menstruation, and then start all over again. So the ovarian cycle is super important. In the ovaries, when we're starting the cycle, we can see these tiny structures, which are follicles. The follicles contain eggs inside. So every month, even when we only ovulate one egg, we will start with lots of follicles in the ovaries. So they're very small at the beginning of the cycle, and then responding to the hormones, they will start producing estrogen. This is the follicular phase of the ovarian cycle. One of these follicles will be like the dominant one, will get bigger than the rest in response to the hormones, and will be like the most preparated follicle, because it will respond better to the hormones produced by the brain. And then this follicle will be the selected one for this month to get ovulated. Then after ovulation, we will have the luteal phase, which is when we have right here the follicle that is the selected one, we have the egg inside, then after ovulation, we will have the egg being released, and then we will have this follicle already empty becoming the corpus luteum. This is the structure called corpus luteum, and this will produce progesterone. So during this part, after ovulation, the progesterone is produced by this structure. And then this egg will be traveling around the fallopian tube, and then maybe it will be fertilized. Then we have the endometrial cycle, which is what happens in the endometrium in response to the hormones. So first, in the endometrium, on day 1, we will have the menstrual phase, where is when we have the menstruation, and all the endometrium will shed, and we will have the bleeding. Then, after that, the endometrium will start growing back again in response to the estrogen. This is a proliferative phase. Then we will have the ovulation, and then the endometrium will thicken a little bit more with the progesterone, and also will be ready for implantation. The implantation window will be open. This is the secretory phase in the endometrium. Okay, let's see day by day what happens. So between day and 4, we will have the menstruation. So the menstruation can last between 2 and 8 days, depending on the patient. Normally between 3 and 7. It's normal also to have it a little bit different every month. During this time, the uterine lining will shed, and then the progesterone and estrogen levels are very low in this part of the cycle. Then, between day 4 and 14, we will have the follicles start responding to the hormones, and they will start producing estrogen. The estrogen will be rising and rising and rising every day more. And then, when the hormones produced by the brain, which is one of them, is the FSH, which is the one that controls this part of the cycle, will drop a little bit, will be rising first, and then will drop a little bit, and one of the follicles will become the dominant one. Then the endometrium will start building up, and also something really important in this phase is that the vaginal mucus will be more elastic, will be ready to receive the sperm, and will be perfect for the sperm to swim into the uterus, and then in case there is a pregnancy, there is a chance of pregnancy. So on day 14, we will have the ovulation. This 1 day or 2 before the ovulation, the estrogen levels, which is this one right here, will be super high. Remember that the estrogen is produced by these follicles. So the estrogen level will be super high, and then this will make that the brain secretes the LH by the hypophysis. So this is the one that in the end makes the ovulation happening. So this is super important also because when we're doing fertility treatments, the medication that we use before one egg retrieval, or when we're getting ready for an embryo transfer during the natural cycle or something like that, we use a medication depending that is very similar or has the function of the LH, and that's why we use the medication that day. So this is the one that produces the ovulation, but is in the beginning, the estrogen levels peaking will be the ones that will send to the brain the sign to produce the LH. So the release of the egg will happen right here in the ovary, and then the egg will go into the fallopian tube right here, and then right here will be fertilized, and then the corpus luteum, which is this structure that we already talked about, will start producing the progesterone. We'll open the implantation window, and then we'll make the vaginal mucus very thickened, so anything can go inside of the uterus. In case there is a pregnancy, this mucus will protect the pregnancy from something from outside, maybe more sperm or bacteria or something coming inside of the uterus. So also the progesterone will make the endometrium mature and will make the endometrium to produce substances that will maintain the pregnancy. From the day 14 to the day 28, this is the time between the ovulation and before we start with another cycle. The progesterone, right here, is the main hormone in this part. It's produced by the ovary that will do like a peak and then drop. The uterine lining will produce chemicals that will support the pregnancy in case we have a pregnancy. If there is no pregnancy, the endometrium will prepare to break down again and for the next period to start. Well, this is the whole menstrual cycle altogether. So first we have here the menstruation. And then in the ovaries, we have a lot of small follicles right there ready to start the cycle and to respond to the hormones. One of them will become the dominant one and will grow more than the rest. So then also at the same time, they will be producing estrogen and then the endometrium will grow like this. So the ovulation will happen. Then the corpus luteum will start producing the progesterone. This also will rise a little bit the temperature in the body, the progesterone. Then the endometrium will thicken a little bit more. The implantation window will be open. In case we have a pregnancy, the embryo will have a chance to implant, and then the embryo will start producing hormones, pregnancy hormones. And this will maintain the corpus luteum producing hormones, progesterone, and a little bit of estrogen. And this will maintain the pregnancy, the hormones produced by the embryo. In case we don't have the embryo and we don't have the hormones of the pregnancy, this will disappear, will dissolve the corpus luteum, and then the menstruation will happen because of the drop of the hormones, estrogen and progesterone. So every month, this is what happens, is our body trying to achieve a pregnancy every month over and over again. So it's really interesting. This is a very quick and basic explanation of the menstrual cycle. And, well, I don't know if you have a question. I'm more than happy to solve all the questions that you have.
Thank you so much, of course, for your presentation. As I mentioned, definitely a topic we never had, but I'm very, very happy that we have it today, and you've been able to explain all those details because, as I mentioned, it definitely it's something that we should talk a little bit more often. I think, because
Yes.
it sounds like it's. I mean, it's so simple, and yet when you hear about it, it doesn't seem so. So
I know.
thank you so much indeed for that. And well, you're very right. Now it will be time for all the questions. So if you have any, go ahead and type those in so that Dr. Jessica can answer. And we do have a first question from Lisa, which is definitely very interesting. And I've actually heard that, and it's confusing many, many times. So let's have a look at it. Okay, let me show you this. So it's, what are the different methods of monitoring ovulation, and which are most accurate?
Okay. So maybe we can put again back the image that we have.
Yeah, sure, of course.
So one way we can check ovulation, well, is measuring the LH. When we do the ovulation test, this is what it detects, the LH levels. Because before the ovulation, we will have a peak in this hormone, and this is the one that we can check with the ovulation test. Also, other method to check the ovulation is to check the temperature daily. Because when we have the progesterone, the temperature will rise a little bit. but it's not so accurate, the temperature. Also, we can check the vaginal mucus because it will be changing during the whole time in the cycle. And maybe we can notice, because during ovulation, it's very like, it can be like super flexible, the mucus. And you can check in that way as well if you're ovulating. The ovulation usually also can be monitored with the levels of progesterone. Also, one of the best methods to see the ovulation, and I will say the most accurate one, is to follow the ovulation or the development of the follicle with scans. That will be like the best one to check with scans. Obviously, it's impossible for us when we're trying at home to have a scan every other day. So I will recommend you what we can do at home. The best one is to do the ovulation test. But always when the patients are trying to conceive at home, I recommend not to center that much in the ovulation, but to try to have sexual intercourse around those dates, like in the middle of the cycle, without trying to check that much the ovulation, because they will be more relaxed. And I think the pregnancy is more likely to happen when we're relaxed and not focusing that much in finding the right time for the ovulation. Something really important as well that I forgot to tell you during the presentation is that this phase, which is the luteal phase, which happens just after ovulation, is usually 14 days long. So when we have a cycle that is more than 28 days, usually the ovulation happens 14 days before we have the next menstruation. So that's why it's not so easy to know when we don't have the exact cycle of 28 days always. But we can try, when we're trying to conceive, try to do it when we know that we're going to be 14 days before the next menstruation as well. That will be really important.
And thank you so much for adding that as well. Thank you for your very first question, Lisa, of course. And sorry, actually, Lisa has added something. Okay, so let me just go straight to that one, and we will go back to the previous questions. Lisa has added, so if my periods are irregular, are ovulation pee sticks to measure LH accurate?
Well, yes, they are. I think they are not the most accurate, like I told you, but for doing it at home is a very helpful thing that we can do. Depending on the kind of periods that you have, like I told you already, we can try to have sexual intercourse like 14 days before when we expect we're going to have the next period. But I always recommend to have it like very frequently, like maybe between 2 and 3 times every week, just to try to have always like some sperm right there, because we have to think about it as well, that the sperm lives more than the egg. So when we are having like maybe 2 times or 3 times every week sexual intercourse, in that way we will have always some sperm in the area, like ready in case we have the ovulation, waiting for the egg.
All right, again, thank you so much for explaining that to that as well. And let's have a look. Okay, yeah. More questions are coming in. Okay, now let's have a look at the previous question that we got. So this was a wonderful presentation, so clear, thank you. And if your cycle lengthens to, for example, 40 days, and this isn't the norm, could this be a cycle with missed ovulation?
Well, not necessarily. So thank you. First of all, thank you for this. So usually, if you have more long menstrual cycles, but also you are having them in a regular way, so if you have them every 40 days, maybe that's normal on you. It's a little bit longer than the normal, but not necessarily is a cycle without ovulation. I think usually you can know, maybe be aware a little bit about your body and the changes that you have. Some women, when we're taking attention, maybe paying more attention, sometimes you might note, first you can be checking the mucus, because it will change during the whole time. Then also the way of knowing if you are ovulating or not, some women might feel like a little bit like in one of the sides, even if you're paying like a lot of attention, you will feel some like small pain maybe around the days of the ovulation, like a pain that goes and comes, like very light, but you can feel it sometimes if you're paying more attention. But not necessarily when you have a longer menstrual cycles is a cycle without ovulation. So maybe we can check also. I would recommend you to do maybe a progesterone test after day 21, just to check if you're ovulating or not. Will be a good idea.
All right, so that sounds about right then as well. Thank you so much. As you can see, more and more questions are coming in, so I'm very, very happy that you have so many questions for sure. And let's have a look. Another comment as well. Beautiful presentation. I would like to know how many days lasts the luteal phase? 14 days.
Yes. Well, the luteal phase, well, not exactly in all patients or in all women, we can say that exactly for sure we're going to have the luteal phase of 14 days, but that's the average. The luteal phase always is more stable than the first part of the cycle. So we can think about it that it lasts 14 days. Not exactly every month and every woman, but the majority of us, we will have a more stable luteal phase of 14 days. That's true.
Okay, again, thank you so much for confirming this. And let's have a look at, well, next question is what can be done to regulate periods?
Well, I would recommend you to stay as healthy as possible, to try to eat healthy, to try to exercise, and to have your body as healthy as possible. Also, for some patients, depending, but some patients with PCOS, for instance, they tend to have a longer periods or irregular periods. And sometimes the medication can help them to have more regular periods. Some medication with vitamins and everything will help them as well as inositol is really good to regulate the periods. But when we don't have the PCOS, I will say a healthy lifestyle will be the best one to have regular periods. Also, something really important, like I told you, the brain hormones are super important to have a regular menstrual cycle. So in case we have a lot of stress, this can be affected. The period can be affected by stress, or maybe we're exercising a lot, too much. Also, is not good. So everything in moderation will help us to have a regular period.
Excellent. Thank you so much for yet another advice. And as you can see, more of those questions are coming in. And I will again go to the last question that we've got because it's a follow-up. Okay, so we will go back to the previous ones again. From earlier question, so if the length of your cycle lengthens and this isn't the norm, so if you usually have a 28-day cycle and it goes to 40 plus, can this indicate missed ovulation for that particular cycle?
I mean, could be also that if we have something different in that month, maybe a lot of stress, or maybe something with the, I don't know, with the exercise, something important that happened. Because I will say the main reason to not have the ovulation or to have a cycle that's different than the normal will be the stress. So usually when we have stress, it means, not necessarily means that we don't have the ovulation, but maybe the ovulation was different than the rest of the other cycles that were more regular at 28 days. So I mean, we cannot know for sure. In case you have the doubt one time, you can do the progesterone test. I will say is the best analysis that we can do to check and to confirm if we have the ovulation in that particular cycle.
All right. Again, thank you so much for the follow-up, of course, and thank you for explaining. And let's have a look. Another question is up. Thank you for your presentation. My period is 26-day cycle, but when I use the ovulation kit, it is strong on day 16 instead of day 14. Is it normal?
Well, usually when you have a 26-day cycle, you're supposed to have the ovulation around day 12. So the LH can vary a little bit. So it's not the ovulation kit is not that accurate as I would like to be. I would like it to be. So I mean we cannot trust it 100%. I will say, thinking about that period of 26 days, I will think your ovulation will occur around day 12. So maybe also you can do the ovulation test a little bit earlier and maybe to check what happens, because I don't think you're going to ovulate on day 14. Also, like I told you, the luteal phase usually is 14 days long in the majority of the patients, but maybe you are a little bit different. Also, I will recommend you to start using other things as well as the ovulation test, like the mucus, the temperature, and also to try to understand a little bit more your body and try to be more receptive. And maybe you can feel something around the day of the ovulation.
All right, again, thank you so much for that. And of course, there was a thank you from the patient for you here. And next question is up. So, what is the usual reason for a short luteal phase, low levels of progesterone, weak ovulation? Is there a way to lengthen it?
Well, sometimes could be. Let's remember that the progesterone is produced by the corpus luteum. So sometimes it's very rare also to having a short luteal phase, like very short, or maybe to have, there are some patients that have low levels of progesterone. In that case, you will feel maybe you could have a little bit of bleeding during the luteal phase, or maybe that's a way that you can maybe think that you're having a low level of progesterone, because you will have some bleeding days before you have the next menstruation. Maybe you can think about it. It's not necessarily a weak ovulation. Maybe it's the corpus luteum that is not functioning in the right way. Sometimes what we can do when we have this kind of short luteal phase is that we can support it with progesterone. After the day of the ovulation, we can start using a very small dose of progesterone to support the luteal phase. There are just a few patients that have this issue, but sometimes it could happen.
Okay, again, thank you so much for yet another one, and let's have a look. Okay, Liz has added here a question. So, if you have had egg removal and your next period is early by 8 days, will the next month go back to your usual cycle? So 36 days later.
Well, usually what happens after the egg retrieval is that you will have the menstruation like earlier than what you expected. Like you say, 8 days will be the normal also to have it. That's because the drop of the hormones. So usually the cycle will start with this menstruation. So it's I don't know if the length of your menstruation usually is 28 days, but usually the next cycle will be very close to the normal, and we can count this menstruation even when it was earlier. We can count it as day one, and usually every cycle after the egg retrieval will be more regular and more regular until we have a normal cycle back again. So I will say maybe this will be the next menstruation will arrive around 28 days later.
All right, again, thank you so much for yet another question, and of course, your answer to it. And you have mentioned this already, but of course, before that, there's a okay, perfect. Thank you from Liz, and there is another question from Lisa. On which day you've mentioned this, right? On which day should
Yes.
progesterone be tested?
Well, usually on day 21, but we can check the progesterone since the day 2 days after ovulation, and the progesterone will be rising. But the day, just to confirm, when we're doing ovulation test, is to check it the day 21. That will be the perfect day because we will have like the progesterone like fully like peaking, and we can see the levels like higher. But you can check it since day 16 when we're talking about a 28-day cycle. So
And again, thank you so much indeed for yet another answer. And let me have a look. At least at this point, we do not have more questions. I guess we will be slowly finishing. However, if you have any questions right now, just go ahead and type this in. And if not, of course, remember that I'm sure that Dr. Jessica and her team at Clinica Tambre will be happy to help you with any questions that you will have. So you can get in touch with them as well. And if not, we will be slowly finishing. But let's have a minute. Let's have a minute. Let's see if we do have more questions. If not, that will be it for today. But before I let you go, anything else, Dr. Garcia? If you anything else you would like to add?
Well, I don't know. I think this is super important. I think it's a topic that I like it so much. Sometimes when we do the consultation with the doctor and when we're going with a fertility specialist or something like that, we don't have the time to explain all of this. And it's super important to know about it because in that way we will understand also, well, the whole treatment, why everything happens in that way, why also we're having the symptoms after the ovulation, is the progesterone. When we have, for instance, symptoms before we have the menstruation, there are some patients that are very sensitive to the progesterone. So I think it's super important, and it's a topic that I like it so much.
Of course, definitely. As I mentioned, this is I'm very happy that we are able to discuss it because this is something that it's definitely out there. Everyone knows it, and when you think about it, some details I think are still missing, and so it's good to be able to review it. Even I would say. And before I let you go, one more question showed one more question from Lisa has shown here. So let's have a look. Okay, why some periods hurt more than the others?
Well, this depends on many factors. Usually, something that I would like to tell you as well is that the periods should hurt, but not that much. A lot of pain during the menstruation is not normal. So I would recommend you, first, if the pain is like super high, I would recommend you to check and maybe to do one scan or just to check with your doctor if everything is okay. And then, well, the pain during the menstruation comes because the uterus, when the endometrium is sheathing, is like contracting. So sometimes when we have more tissue, also could be like a little bit more like difficult to the uterus to completely sheath the tissue. So this is normal to have some periods like having more pain than the others, and this is by the contractions of the uterus. Also, the hormonal levels could also be implicated in the difference in the pain in 2 cycles, but it is normal to have different amount of pain during the menstruation.
All right, again, thank you so much for that question indeed, and of course for your explanation. And one more, okay, from Sylvia. What are the premenstrual symptoms?
Well, these are the symptoms that are caused by the progesterone levels. So we can feel like a little bit bloated, like a hormone humor changes. We can be like a little bit more sad, or more like I don't know, more like feeling like we want to cry for everything, or we want to, I don't know, we're like a little bit moody. Some patients don't have anything at all, but some patients are very sensitive to the progesterone. You can also feel like depressed a little bit, like it hurts, or discomfort. So these are the premenstrual symptoms, and they are caused by the progesterone.
Okay, thank you so much for yet another question, of course, and that answer. One more, okay, from Lisa. So let's have a look. So, is it normal for your breast to hurt during period?
Well, usually it is more normal to have it the days before the period, and maybe could be at the beginning of the period as well, because also for the action of the progesterone. Also could be because the progesterone levels are dropping, and that could cause a little bit of pain in the breast. It is normal. It's part of the hormonal changes during the menstruation and during the menstrual cycle.
Excellent. Thank you for the confirmation, of course, as well. And let me have a look. I guess that was our final question, although someone is typing. So I just want to see if it's a comment or of course, a question. Yeah, it does seem like it's a thank you. So we will be finishing for tonight, but thank you so much for all the questions. I'm very, very excited that we have so many questions on this topic because this, as I mentioned, it's really incredible to be able to simply show you all those topics, and I'm very happy that we were able to discuss it today for sure. So thank you so much, Dr.
Thank you.
Garcia,
It was a
for joining us.
pleasure.
It's definitely a pleasure. And as you can see, many thank yous are coming up your way. As you can see, thank you for the interesting meeting and your presentation. Thank you so much. Very interesting. What can I say? Really, couldn't agree more than this,
Thank
of
you.
course. So thank you so much indeed. And one more. Sorry, just need to show you. Thank you for the
Thank
presentation.
you. It's a
Thank
pleasure.
you. It's great to be here with you all, and I do hope that it's been very useful for you as well. And of course, remember that it has been recorded. You will have a chance to watch this again, and when we finish, you will be redirected to our Dr. Jessica's profile, so you know there was a webinar with her, previous webinar with her, so you can check it out as well. And of course, I also want to mention that. My IVF answers, we are definitely happy and proud that there were over 300 IVF webinars so far. So if you are looking for some information, I think it's a nice place to be to check and see, as there are many topics, and I'm sure you will find it useful. And as you know, we will be back here tomorrow, actually with a colleague of Dr. Jessica, because we will have another doctor from Clinica Tambre. Dr. Elena Santiago will be here with us. So I hope you will be able to join us. We have another interesting topic, and I'm sure, I am definitely sure you have lots of questions. So just come here tomorrow at 8 p.m. UK time, and it's going to be interesting as well. Okay. Thank you so much, Dr. Jessica, for joining. And it's always great to have you. Thank you. And now I hope you will have all a relaxing evening, and I do hope to see you tomorrow. Thank you
Thank
so much.
you.
Take care.
Bye.
Bye.